Hey everybody, good morning, good afternoon, good evening, whenever you watch this YouTube video. Welcome to this class. This is a presentation that I've titled Building Your Health Equity, and we're going to be covering the topics of nutrition, we're going to be covering the topics of physical activity, and we're going to be covering the topic of sleep. So I want you to stay tuned because we got a lot of great content coming your way. So here's a little bit about me. So I am a chiropractor. I also hold a master's of nutrition. So I have a little bit of knowledge about both of these areas, and I'm excited to share these topics with you. And those are the contact information details right there. Here is the boring legal disclaimer stuff, so you can read that at your leisure. So the reason I designed this presentation is it's something that I hear from my patients all the time, and I figured I would just make a video that kind of explains the overarching way of how we can rebuild our health equity one step at a time. This presentation is nice because I cover it into 3 distinct chunks, so you can kind of look at them as chapters if you want. And the nice part is you can fast forward or rewind to wherever you feel like you need it most. So if you're looking for sleep, head right to the last third of this presentation. If you're looking for nutrition-based information, it's in the middle, and we're going to begin with some physical activity stuff. So just to set the context, when we look at our lives, the thing that I hear about a lot of people is they want to do better, they just say that I just don't have the time. And what I like to remind everybody, including myself, is we each have 24 hours in the day. And what we need to do is we need to build compliance, and sometimes it's very, very tough. So what I always say is let's choose the lowest hanging fruit. Let's pick the easiest thing that you can do that's going to give you the groundswell so that you can say, hey, you know what? I mastered that skill. Let me add something else. So we always try to find that easiest bang for your buck. That way you have higher compliance, you feel better about yourself, you're seeing positive changes, and then we can build. So this really comes down to what I like to look at as a mindset shift. So instead of saying, yeah, but, let's reframe that to say, yes, and. So I've chosen to use a wellness wheel for this slide. We have 6 different facets within our life. There are many different versions of the wellness wheel, but I chose this one, and I picked the 3 most common. So I picked physical activity, nutrition, and sleep. Stress management, definitely important. Mental and behavioral health, also important. But we also want to reframe everything by saying, what is your why, right? When you have your why, everything else seems to fall into place. So this is where we're headed. Okay, so here we are, part 1, physical activity. So some of the common presentations that we see all the time, people will say, hey, you know what, these tight muscles, they never go away. I massage them, I use a lacrosse ball, I use one of those percussive tools, I do this all the time, and I just am not getting any better. This tightness is never going away. Or they'll say something like, I'm losing my strength and I'm also losing my flexibility even though I exercise on a regular basis. So even though we do things that are deemed helpful for our bodies, we're still finding that we're still in pain, we're still losing our range of motion, we're losing our strength, right? So what does physical activity really mean? So when we look at physical activity, we only get one body and we want to treat it as best as we can. So this is a statistic that I pulled from Dr. Kelly Starrett from his book called Desk Bound. And basically he equates that for every 10 hours that we sit during a day, if we exercise for 60 minutes, it's reduced by magnitude of 90%, meaning the 10 hours that you sit have eclipsed that 60-minute workout and turns into realistically about a 6-minute workout in terms of your health fitness quotient. And that's pretty telling when you think about it. So we go back to that previous slide and we saw the people that exercise daily and they still have these stresses and strains. So we're starting to see a lot more about sitting and how detrimental it is to our health. So we as humans were designed to move, but if we spend anywhere from 8 to 14 hours, depending on the statistics you look at, that 60-minute exercise that we do gets reduced even further. So it's almost like you did nothing at all. And that's where a lot of people just say, well, if it turns out to be 0, then I might as well not even exercise at all. And that's the wrong approach. So we're here to flip the script. So another statistic that I found was the 4th leading cause of mortality is physical inactivity. And that's right behind heart disease, stroke, and HIV/AIDS. So what we want to look at is we all have 24 hours in a day, like I mentioned before, and if we equate 1 of those hours for exercise and approximately 7 hours for sleep, that gives us about a third of our day. So what do we do for that other 66%? Are we sitting? Do we have jobs where there's a little bit of physical activity? So we have to kind of determine that as well, because sometimes you're able to build in fitness during your work day and you don't even know you can. So we're here to change some minds. So what we also look at too is we have to talk about the tissues themselves. So are we talking about muscles? Are we talking about ligaments? Are we talking about structures like the bones? And what we want to do is we want to say, where's your pain situated? And then we can start to expand. So again, this is another illustration that I pulled from Kelly Starrett, Dr. Kelly Starrett, from his book Deskbound. So most of us have some sort of knee pain, shoulder pain, a hip pain, a neck pain. There's some sort of ache or pain, and typically we develop these aches and pains and strains, not only from the amount of sitting that we do, but also the job that you do. So if you're somebody who does standing for a long period of time at their work, you're going to develop the pains and aches and strains of someone who does that job. If you're someone who sits and drives a truck, you're going to develop those pains. If you're a chiropractor, you're going to develop lower back pain, some shoulder pain. If you're a painter, you're going to experience your different kind of pain. So insert your job, and you're going to notice that you're going to have pain that's representative of the work that you do. Another thing that we look at is we overlook this, and it's posture. Right? So what we see is the individual on the left, we see this gal over here, right? She's got perfect posture. And then we see this gal here, which she's got a rounded upper back. She's got a bit of a sway back going on, and her alignment, her spinal alignment is not optimal. And why this is important is because when we have misaligned posture, the muscle tissues end up doing more work, as well as the ligaments. This is also true for our individuals that do a lot of sitting at our offices, right? So this individual here in the center has this curve, the neck curve, the upper back curve, and the mid back curve. They're in a suboptimal position. So this individual starts to develop neck pain, they start to develop upper back pain, they start to develop lower back pain, maybe some tingling into the legs. The individual to their right is sitting in a more aligned position. So this individual is also working at the same workstation, but they've optimized their workspace. And in doing so, they're putting less stress and strain on the spinal ligaments and the muscle tissues that hold this body upright. So this person's in better shape than this person. The final image that we have on this sheet is very, very important because we have a lady who's using her cell phone, and we all use our cell phones on a daily basis. So your head weighs about as much as a bowling ball, which is about 10 to 12 pounds. And what happens is for roughly every inch forward or percentage of degree that your head shifts, you're adding the equivalent of another head's weight. So in this particular illustration, they're using degrees of motion. So this individual here, her head is in an optimal position because her phone is in an optimal position. And when we use our phones, this is a side moment, when we use our phones, this is the position you want to be in. You want to have your phone lifted up, elevated, so that way it's more in alignment with your eyes. Failure to do so, and we end up with the image in the middle. So this gal here, she's looking at her phone as we typically do. So her head is about a 45-degree angle, so her head is magnified about 5 times. And you can just imagine the amount of stress and strain this individual is building into her neck and her upper back, and also towards her mid-back between her shoulder blades. These are the guys and gals who come in and say, you know what, I have this pain in my body and I just don't know where it's coming from. And then we talk about cell phone use, and they say, yeah, this is me right here. So I always explain to them, this is where most of your pain is coming from. And if we take that example and make it even further, such as you see with teenagers where the phone is mostly in their lap, we can see that this individual is putting even more stress and strain on their body. So we have to fix that. So I want to rewind a little bit and give you a little bit of context in terms of the physical activity. So when we have muscle tissues that are tight, what ends up happening is those muscle tissues are guarding against a perceived weakness that the body perceives. Weak muscles we always perceive as tight, which is why we always want to stretch these muscle tissues. So while sometimes it is therapeutic to stretch something that feels tight, the correct answer is to simply get strong. So what we want to do is we want to take a muscle tissue that is weakened and give it some strength. Another concept that we see in the physical therapy world, the chiropractic world, and the strength and conditioning world is when you have a loss of mobility or movement, it's typically preceded by a loss of stability somewhere else in the body. So what does that mean? What that means is if you're someone who has shoulder pain, you used to have full range of motion of your shoulder and you had no pain whatsoever. An event happened, whether it was a big traumatic event or it was something that kind of slowly built up over time, that shoulder got stiff. And when the shoulder gets stiff, everything starts to shift. So your body starts to take pieces away to add pieces elsewhere. So that's where we start to run into these headaches. So what we want to do, like I mentioned just previously, is we want to stretch what's tight and we want to facilitate strength on top of that. And we also have to strengthen what's weak. So it's not just stretching is the answer. We have to strengthen as well. So when we look at this diagram here of this gentleman laying on his back, most of us have a pain-free range of motion and a pain range of motion. So if we look at this diagram and we consider it as being 100% in terms of motion that we want, this individual here has about 80% pain-free range of motion, and they typically have pain in that upper and that bottom 10%. So what happens is most people, they'll come in and they'll say, hey doc, I'm feeling pretty good, but I have pain when I start movement or I have pain towards the end of movement. So the whole goal is we want to make sure that you have enough strength and enough stability so that we can take these pain areas and reduce them and push them back as far as possible so that you have better access to full range of motion as well as pain-free range of motion. And we also want to build strength within that range of motion. So that's a higher level concept. I know it's kind of complex, but I feel like this diagram does a pretty good example. So what I've done for the sake of brevity is I've taken two physical activity tips. So this individual, her name is DocJenFit. She's found on YouTube. She also has an Instagram channel. She's amazing. And I've picked two videos that typically encompass most people that we see in the chiropractic office who have neck and upper back pain, as well as lower back and mid back pain. So these two videos I've included. You can look for the thumbnails on YouTube, and I've also included the link here as well. So I'm not going to go over these just for the sake of time, but she does a great job in terms of explaining some of the stuff that I've done, and she's also given you textbook exercises to alleviate your neck upper back pain as well as some of your lower back pain.